Hello and welcome to Medical Dialogues. I'm Mr. Zaman. Let's look at today's top headlines. FMGs with course completion certificate allowed to appear for screening test according to MOS Health. Ukraine returned medical students who came back home due to Russia-Ukraine conflict are allowed to appear in the foreign medical graduate examination if they have obtained the course completion certificate by their respective parent institute, the Minister of State for Health Dr. Bharati Praveen Pawar informed the Parliament recently. Further, the MOS Health told the Rajya Sabha that after clearing the FMGE, these medicos will have to undergo compulsory rotating medical internship or CRMI for a period of 2 years to make up for the clinical training that they could not complete in their parent institutes. This comes after recently the Supreme Court had directed the Union Health Ministry and National Medical Commission to consider the situation of the Ukraine returned medicos on humanitarian ground. Spurious medical drugs worth Rs 23.22 lakh seized in Odisha. Spurious medical drugs worth Rs 23.22 lakh were seized in Odisha's Cuttack on Friday, a statement said. Raids were conducted by enforcement teams of the health department in Naya Sadak in Puri Ghat police station area and the seizure was made, it said. These drugs were found to have been procured from UP. Total drugs worth Rs 23 lakhs 22,948 was seized, it added. Some spurious drugs were also seized from a medical store in Bargarh, it said. Cystic fibrosis drug could help treat pneumonia. Pathogens such as SARS-CoV-2 and pneumococcus can cause severe pneumonia. If the airways then fill with fluid, the patient risks developing acute respiratory distress syndrome. Researchers at Charité Universitäts Medicine Berlin have now discovered the molecular mechanisms that trigger fluid accumulation in the lungs. This also led them to discover a potential new therapy, a cystic fibrosis drug proved effective in their laboratory experiments, raising hope that this could be used to treat pneumonia regardless of the pathogen that caused it. A cystic fibrosis drug proved effective in their laboratory experiments, raising hope that this could be used to treat pneumonia regardless of the pathogen that caused it. The study has been published in the journal Science Translational Medicine. Pneumonia is the most common cause of fluid buildup in the lungs. This condition, known as pulmonary edema, results in parts of the air spaces filling with fluid instead of air, which prevents them from doing their job of exchanging gases. Patients struggle to breathe and their body can't get enough oxygen. The diagnosis is acute respiratory distress syndrome or ARDS. The researchers have now shown for the first time that cells in the blood vessels of the lungs also have CFTR and that its presence is drastically reduced in pneumonia. Rs 10 lakh penalty if doctors' original certificates not returned within 8 weeks, says Madras High Court. The Madras High Court bench recently slammed the University of Madras for withholding the original academic certificates of a retired biochem professor. Giving an 8-week ultimatum to the university for retrieving the certificates, the High Court bench also has clarified that if the registrar and the HOD of the biochem department fail to give them back, when they would be liable to pay Rs 10 lakh compensation to the professor. While the concerned professor had submitted the certificates for TN Senior Scientist Award 2016, it was alleged that the university authorities falsely denied the receipt of the certificates. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.